It's almost impossible to walk past a supplement bottle labeled Hello Happy or Happy Drops and not want to grab it. But the truth, the supplement aisle is a minefield of marketing. Today, we're cutting through the noise using the latest clinical evidence to see which supplements actually move the needle for mental health. But before we dive into the bottles and pills, we need to address the foundation. I want to be very clear. You cannot supplement your way out of a poor diet. While these compounds are powerful, they are designed to supplement and not replace real food. When you eat whole nutrient-dense meals, you aren't just getting one isolated molecule. You're getting a complex matrix of fiber and phytonutrients that a capsule simply can't replicate. If you missed it, I posted a deep dive last week on the exact foods that improve brain health, so definitely check that out after this video to get your foundation solid. But if your food base is ready and you're looking for that extra edge, let's jump into the 5 mood-boosting supplements that are backed by real science. First up, omega-3 fatty acids. If you're only going to choose one supplement, this is probably the one to start with. Omega-3s hit your brain from 3 angles. They help calm neuroinflammation, improve the flexibility of your brain cell membranes, and support how well your dopamine and serotonin receptors actually work. So this isn't just about a quick mood boost. These fats help your brain adapt, stay resilient, and protect itself over time. If you're dealing with chronic stress or depression, this is one of the few supplements that can genuinely move the needle. But, and this matters, it has to be the right kind. Look for EPA on the label. You want a formula where EPA makes up at least 60% of the total omega-3 content. That's the form most strongly linked to mood support. Good sources include high-quality fish, krill, or algae-based oil options. And one more key point, omega-3s tend to work best as an add-on, not a replacement. The research shows they can have moderate to strong effects when combined with other treatments that are already in place. These next 2 supplements help your brain make neurotransmitters like serotonin, dopamine, and norepinephrine, SAMe and L-methylfolate. To understand why they work, we have to talk about MTHFR. Think of your body like a factory. To make the happiness chemicals, you need folate. But here's the catch. Your body can't use raw folate that we get from food. It has to be converted into an active form called methylfolate. Now imagine the MTHFR gene is the factory worker responsible for that conversion. If you have a common genetic variant, which many of us do, imagine that worker is basically on a permanent vacation. The conversion doesn't happen and the line stops. Add a B12 deficiency into this mix and your folate gets totally trapped at the loading dock, leaving you stuck with brain fog, fatigue, and irritability. This is where SAMe comes in. SAMe is a universal methyl donor, meaning it carries the spark needed to actually manufacture those neurotransmitters. It works downstream from the MTHFR process, so it's the final step in getting your brain the chemicals it needs. So by using supplements like L-methylfolate and SAMe, you're essentially bypassing that broken factory line and delivering the finished mood-boosting goods directly to your brain. So what does the science show about their effects on mood? SAMe, this one is impressive. It's been shown to be just as effective as some conventional antidepressants for milder forms of depression. Doses usually range from 400 to 1600 milligrams. Note though, if you have bipolar disorder, talk to your doctor first as it may trigger mania, although rarely. L-methylfolate, remember this isn't standard folic acid, it's the active form. If your antidepressant needs a boost, 7.5 to 15 milligrams daily has shown benefits within just 4 weeks. Now, a quick reality check on methylated B12. While it's a huge buzzword in the wellness world, the science tells us that more isn't always better. In fact, global supplementation, basically taking it just for the sake of taking it, isn't actually proven to help the average person. The research shows that B12 only really flexes its mood-boosting muscles when you're actually deficient. This is a big one. Studies have actually shown that having too much B12 in your system can increase your risk of depression. So before you start loading up your cart, remember that a simple blood test can tell you exactly where you stand. This is especially relevant for those following a vegan or vegetarian diet where B12 deficiency is much more common. If that's you, or if you've just been feeling off lately, ask your doctor for a quick lab check. It's the only way to know if you really need the boost or if your levels are already right where they need to be. We can't talk about the brain without talking about the gut. We now know that your gut health directly impacts your mood through what's called the gut-brain axis, a two-way communication system linking your digestive tract and your brain. Your gut microbes help produce key neurotransmitters like serotonin, and they influence inflammation, which can directly affect mood. This communication happens through pathways like the vagus nerve, immune signals, and hormones. When the gut is out of balance because of poor diet, chronic stress, and the overuse of antibiotics, it can disrupt the system, contributing to symptoms like brain fog, low mood, and irritability. This is where probiotic supplements enter, as they can help support a healthier balance of gut bacteria, therefore strengthening the gut-brain axis. Research has found that people taking a multi-strain probiotic over the span of 8 weeks, specifically taking around 8 billion CFU daily, report significant reductions in both depression and anxiety symptoms. Let's wrap things up with the two heavyweights you've almost certainly heard of. The good news: unlike a lot of wellness trends, these actually have a solid foundation of clinical evidence supporting their role in mood regulation. While you'll often see magnesium citrate on shelves, magnesium glycinate is the real MVP for mood. Glycinate is bound to an amino acid that makes it highly bioavailable, meaning it actually gets absorbed and sent straight to your nervous system. It's basically nature's chill pill. It's much gentler on your stomach and way more effective at telling your brain it's time to relax. Studies show that it can work quite fast. Some patients see a drop in anxiety scores within just 2 weeks of taking it nightly. Then we have vitamin D, the sunshine vitamin. Now, the evidence here is a bit of a mixed bag, and that's because vitamin D only really works its magic if you're actually running low. If you're deficient, supplementation can be an absolute game changer for your mental health. But if your levels are already healthy, adding more won't give you a super mood. If you've been struggling with fatigue and low moods, low energy, ask your doctor to add a vitamin D check to your next blood draw. It's a simple fix. Now, you might be wondering why I didn't include St. John's wort on this list, despite the evidence showing its benefits for mild depression. The truth is, as a doctor, I find it needs much closer monitoring. It has a massive list of interactions with common medications, including birth control and antidepressants, so it's never something you should start without a direct one-on-one conversation with your doctor. In summary, supplements are powerful tools, but they work best when your nutrition, sleep, and movement are already in place. Always talk to your doctor before starting a new supplement, no matter how safe it may seem. It is important to consider drug interactions and individualized treatment plans. Don't forget to check out my nutrition and mood video from last week for the full picture. If this was helpful here for you today, hit like and subscribe. We're talking about allergies next week, so I look forward to seeing you then. Be well.